Hey everyone, it's Marianne from the New York City Organization of Public Service Retirees. This is Michael Mulgrew at the Florida RTC chapter meeting, number 8. So this one is a little interesting. There's a lady asking a question about the budget cuts from the mayor and why is it that the mayor is doing this when many of the cuts had been restored because the funding was clearly there, and there was that whole kabuki budget dance that they do on an annual basis under every single mayor, is that they all talk about these fiscal cliffs, including Michael Mulgrew, and supplanting money, and then all of a sudden money's found and everything is back in place. And how come it's not being put back in place for retirees? And he goes into this ridiculous explanation without ever taking ownership that he was the one that was behind the current situation. Watch this.
Go ahead. When you sit at the table with the mayor, people in New York, there have been instances where the mayor has had to reverse budget cuts, contracts awarded where money has been wasted or frauded. There's been fraud, sometimes circumventing the controller. The money for what's going on politically with immigrants. Where is it that it's justified that we're being cut to a Medicaid Advantage plan while all this other waste of money is going on in the city, and who questions it and who sits there and said, no, if you're doing all of this and throwing away money on all of this, you're not going to throw us onto a Medicare Advantage.
It was always about creating a better system for us to deal with the healthcare costs.
But see, you weren't dealing with healthcare costs for Medicare eligible retirees. You were dealing with medical costs for active in-service workers and under 65 retiree health plans. Not your Medicare eligible, Mike. Tell the truth.
That's what I started with. Okay,
it has to be. It's not a better system.
Listen, with the increase of costs that we were dealing with, and that's not just retirees, it's in service. With the increase in costs, we were like, can we build a better system that protects our rights and benefits and allows all of our members to get the high quality care they deserve? That's what this is about. So they're not talking about us. We want to say it's premium free, high quality healthcare at all times. There's no discussions. It's off the table when it comes to the city. Now, the city, who fights with the city about budgets? We all do. We're probably the loudest union. He just did cuts in the schools. We got most of them reversed, right? But it's not like it's okay for us to pay one hospital $85,000 for a knee replacement surgery and another hospital $37,000.
So why did you destroy an entire system because of one hospital? And the one hospital you keep arguing about and you don't always mention is Presbyterian, because that was the one hospital that labor went after a couple of years ago in that one United letter. But what you're not understanding is that you imploded an entire system because of that. And you took people off the safety net of a federal public health benefit. And yet these excuses for an English teacher from Brooklyn, as you described yourself, is just ridiculous.
$1,000, and the better knee replacement is the $37,000.
According to you.
That's not all right. And somebody needs to hold them accountable. And nobody's doing it. And we said, enough. Enough. And just because a hospital puts all these commercials on TV and everyone, oh, that's a great hospital. I'm telling you, they're doing something that's probably not as good as others. Maybe one type of thing or something else, but that doesn't stop them from charging us. Everything is about charging. And we're not going to let that industry.
UFT retirees should not be on the cutting table.
You're not being cut.
You are
I'm going to
being
say this
cut.
one more time. And the whole idea here is this union has a history of always seeing around the corner and preparing and having a strategy for it. I'm going to finish now. That's what this union has always done. We see problems before others, and then we put a strategy in place and do it. We saw all of these crazy costs. We tried to do the regular way, but the costs kept going up and up. And the more we dug into
But the costs did not go up and up for Medicare eligible retirees. We've said this many times, and I'm going to say it again. Medicare started out at $3 per person per month in 1965, and today it's about $174. That's not up and up, Michael. The senior care supplement started at about $88 in 1997. I don't have rate sheets going before then, but I can tell you from $88 in 1997 to about $200 when you started this, that's still not up and up. So a Medicare eligible retiree costs the city less than $400 a month. The in-service worker plan today is about $1,000 a month individual and $2,500 a month family. Tell the truth. You sold off your Medicare eligible retirees, privatized their health plan, took them out of a union plan, put them into a for-profit managed care plan to take the value to finance yours. Say it with me. I know that the first time it'll hurt a little bit, but it'll get easier when you tell the truth.
to this, we realized that an insurance company who we're all paying for, to protect us and advocate for us, weren't doing it. So in a hospital, all of a sudden, they're not just about care anymore. They're about huge.
And you can't really say that because Emblem Health, which is the not-for-profit unionized healthcare plan, was negotiating their rates. And they'll even tell you that their reimbursement rates to the providers are at 1986 levels. So that's not true either.
Profits. So if we don't stop this system, no, we don't stop this.
And you want to talk about incivility to the RTC, about even the retiree advocate? You're saying that they're incivil and shouldn't be elected. Look at what you just did. Yeah, no, and then you cut people off and you don't want to let them speak. Come on, Mike. That's just not cool.
The system, it's just going to escalate out of and become uncontrollable. So we said, we are going to do this. We're going to do it differently than anyone else. Yeah, right now, hospitals are petrified because we also got the Hospital Transparency Act passed through the city council.
That Hospital Transparency Act is a sham. A city council has absolutely no jurisdiction over hospital pricing. Now, if you went back to the rule that was rescinded, the law that was rescinded in 1996 by Governor Pataki that actually regulated hospital pricing, that's a different story. That city council office, it's not funded. There's no mandate. There's no staffing, and it has no jurisdiction whatsoever.
And they're trying to stop that now because it actually will allow everyone to see what a hospital charges.
You already know what hospitals charge under federal law. They are required to post that on their website. And if for some reason you're having trouble getting that data, you can call them and they'll give it to you. That is actually a federal law.
Allow people to see who does a good thing and who does a bad one. Why was this union by itself, not the MLC, the first union to have an individual set up for Memorial Sloan Kettering?
So, Mike, I just really think that there's a lot that you're not telling people about their health benefits, and this is one of them. You privatized their health care. You took them out of a federal public health benefit and you put them into a managed healthcare plan by a for-profit insurance company. The same kind of companies that you're berating want nothing but profits. That's not healthcare. You stripped away choices for healthcare, and now you're doing the same thing for the in-service workers. You diminished our current retirees' health benefit. An in-service workers' future healthcare, you stripped away, both on your advocacy and your advocacy in the Municipal Labor Committee. And you're not telling your in-service workers you just stole their future. And then you say you're going to also do this currently with an RFP, a very aggressive RFP for the active worker in-service healthcare plan. Let them know they have 11 plans today. If your RFP goes through, they're going to have one or two. One will be managed care, and the other one will look like managed care. Come on, Mike, you could tell them that. Mark my words. Have a good night.